Today is one of those days when people who care about politics are well aware that something really big has happened. Even though it didn't pass and become law, this was the first major legislation that was moved through the House in the Trump era. And if you care about politics and you care about the Trump administration and you care about what this new administration is going to be like, you know that's a big deal. And you probably watch cable news on the regular. But this is also one of those days when people who don't watch cable news on the regular and people who don't particularly care about politics or who don't particularly have a partisan interest in who's up and who's down, a lot of people care about what happened today, too, even if they don't usually follow Washington. And that's because health care hits all of us at home, all of us. We're lucky tonight to have with us here tonight one of the true experts on this subject. Professor Jonathan Gruber is an economics professor at MIT. He was an architect of the Affordable Care Act and of the Massachusetts law before that. That was sort of a model for the ACA. Professor Gruber, thank you very much for joining us tonight. I really appreciate your help going through some of these particularities. It's
my pleasure, Rachel.
Let me first just ask your overall reaction to this passing today. I wonder a little bit if I am being too much of a dark cloud here, if this actually can be seen as a good healthcare reform in some ways.
You know, Rachel, it's hard because, you went through your list and it sounded partisan, but it was all true. I mean, look, there is nothing to recommend this law except for people earning more than $250,000 a year. It decreases insurance coverage dramatically. It raises premiums. It reduces the certainty we all get from insurance by removing the protections that we may have from losing our insurance because we're sick or not getting covered because we're sick. There really is nothing to recommend this law, honestly. I just don't know why they're doing it other than pure politics.
Let me ask you actually about what you just described as the only benefit here. There is this, as far as I can tell, this $300 billion tax cut for people who make over $200,000 a year, families who make over $250,000 a year. Why is that here? I mean, does that have any healthcare benefit, or is that literally just free money for the richest people in the country?
Look, the idea of the Affordable Care Act was to have a balanced approach to financing coverage for our lowest income Americans. About half of the financing came from spending cuts. About half came from tax increases. And of that half, the largest tax increase was tax increase on the wealthy. So as part of a balanced package to make sure the Affordable Care Act was actually deficit neutral, actually was deficit reducing. The Republicans didn't like that tax increase, and however, getting rid of it's expensive. And if they got rid of it as part of their larger tax reform, which they want to move next, that would make their tax reform that much harder to move under Senate financial rules. So by getting rid of this tax cut here, by using cuts in Medicaid to pay for their tax cut, getting rid of the tax cut in this round, they make the next round easier. It really, I think, Rachel, I'm not an expert on historically, but I think this is one of the largest pure redistributions from poor to rich in one bill we've ever seen.
Okay, that's hard to hear. Well, let me ask you about this. Talking about that huge cut to Medicaid. Obviously, when you're talking about health care, national health care expenditures, national health care line items, it's a lot of really big numbers because health care is a big expense and it's a big portion of our economy. But when I started looking through, trying to come up with that list of the practical impact, it really seems to me like, obviously, if you're going after Medicaid, you're going after poor people, directly bullseye. By making it so that you can charge old people 5 times as much for the same insurance you'd offer to young people, obviously that's going right at older people. And then, obviously, there's this big benefit for rich people. So, I mean, is there anything else that's going on here other than hurting the old, the sick, and the poor and benefiting the healthy and the well-off?
Look, primarily that's what the law accomplishes. We've heard Paul Ryan. He said that he was dreaming in college over kegs of cutting Medicaid. I mean, he admitted that in a speech, that basically the Republicans for years have not liked this program. But I think it's very important for your listeners to recognize that even if they don't know the kind of low-income families that benefit from Obamacare, the Republican alternative would go much beyond cutting the Medicaid expansion of Obamacare. It would cut Medicaid generally by 25%. And what not a lot of people realize is the vast majority of spending on Medicaid is not on poor families. It's on the poor, elderly, and disabled. 2/3 of the money that Medicaid spends is on the poor, elderly, and disabled. This Republican bill is not just about clawing back 24 million people's health insurance. It's also about restricting by 25% a program that's a lifeline for our lowest income elderly and disabled.
Jonathan Gruber, professor of economics at MIT. Professionally, you make me feel better because you said I didn't screw up the way I explained it, but personally, you make me feel terrible in terms of what I see all the more clearly about this bill. Thank you for your time tonight, sir.
You bet. Thanks.
Thank you. All right. Much more ahead tonight. Congressman Adam Schiff is here live next. Stay with us.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.